Hi, my name is Tasha, and today I'm going to be performing a skill video assessment on deep tendon reflexes. To begin, I will perform hand hygiene. I'm going to close the door to ensure patient privacy. I will be introducing myself to the patient and verifying their identity. My name is Tasha. I'm going to be your nurse today. Can you please tell me your first and last name and date of birth?
Aiden Perez, 06-1907.
Thank you. Today I'm going to be explaining the procedure to you. So we will start by assessing your reflexes, and we are going to do this with the reflex hammer. I'm going to gently start by tapping on 4 areas. This is going to begin with biceps, your triceps, your patellar, and then we're going to go down to your Achilles tendon. Doing this procedure is going to help check your body's reflexes and motor system function. This test can be done by to anybody, but we mostly do this on patients who are pregnant because it is very important for that. And obviously you're not pregnant, but this can help them because it'll help detect preeclampsia. For example, like if a patient's pregnant and the reflexes are hyperactive along with other signs, it may suggest the patient has preeclampsia. Okay, so reflexes that we do are graded on a scale from 0 to 4. 0 is no response, 1 plus is going to be diminished, 2 plus is normal, 3 plus is brisk, hyperactive, 4 plus is very brisk with clonus. All right, and so we normally test both sides on the patient, but for video purposes, we're just gonna do one side. And we are gonna start with your biceps today. So we're gonna make sure that the patient has their arm right in front of them and completely relaxed. I'm going to be supporting the patient's elbow. With one hand, I'm going to place my thumb over the tendon and then tap it right above. And this is going to be with the pointed side. Okay. A normal response is a slight movement in the forearm, which we did see here. Next, we're going to do the triceps. So we're going to make sure the arm is up, relaxed, and in an L shape. The arm should also be relaxed, so go ahead and just fully let me go ahead and relax, and I will support the arm. I'm going to find the tendon above the elbow and tap it with the pointed end of the hammer, and it should be just, all right, perfect. So the forearm did show normal responses there. Go ahead and relax. I'm now going to go down to the patellar tendon, which is just below the kneecap here. My patient should be relaxed, which he is, and dangling. I'm going to find the spot just below the kneecap, and I'm going to use the flat end this time to tap. A normal response is when the lower leg kicks forward slightly, which we did see here. Next, we're going to go to the Achilles tendon. Again, his leg still needs to be relaxed for this as well, and dangling. I'm going to support the foot. And then I'm going to tap the tendon using the flat end of the hammer, which is the back side of it here. Perfect. A normal response is meaning the foot goes a little forward, which we did see that. So next we're going to do the clonus check. So this is where I assess the clonus. With this foot completely relaxed, I'm going to quickly dorsiflex the foot and let it go. If it stays afterwards, then it's a normal response. If it stays up repeatedly and jerks, it would be an abnormal. Relax your foot. Okay, and we do have a normal response here, so it's negative clonus. So this is going to conclude my deep tendon reflex assessment. Again, I want to ensure that my patient is comfortable. I will perform hand hygiene upon exiting the room. All right, thank you.